rise, as it were. Prof?
Yep.
There's a study, I don't know if you saw Monday's newspaper, right? Civil service, about the really, really depressing numbers. And I'll get to some of the issues in a bit, but what Professor P.S. Gathesha was saying was that a year ago, 5,000 civil servants were diagnosed with mental health. 5,000. A year later, 13,000. That's almost 300%.
And that's an underestimate. It's an absolute underestimate, because there are many who have problems that are not reported because they're not getting the help that they need. There are many who have problems that are getting help without reporting to anyone because they are stigmatized at their place of work. People will start saying, "Mwenda wazimu." There are many who have lost their jobs because of their mental illness. Nobody reports on that. There are many who have died by suicide because of their mental illness. Nobody's reporting on that. So the figures we are seeing are only what we call official figures. They're always an underestimate. You can multiply that figure by 10 within the civil service.
Alone.
And those are the number of people who have problems, who need help, and who need services, and they're not getting services. A study was done around here in Nairobi many years ago, looking only for depression among people who go to hospital for any reason. Like you're coming to hospital because of a headache, or a stomachache, and so on. And these guys went in and just looked for depression among these people. And they had not come to hospital for mental illness. 40% of them had depression. 40%. And they did not come to hospital because of depression.
No.
Out of those 40% with depression, only 4% had been diagnosed previously with depression. And out of those, a tiny perishing percentage were receiving any kind of care, any kind of appropriate care. And this is a situation that is prevailing even today. I will tell you, I mean, if you look within Citizen, 1 out of 4 people, and that's an underestimate, I repeat, has some mental health problem.
And yet, Senator,